So here's what's going on with the Social Security Administration, but here's the issues you're going to have to deal with. If you call up and say, well, I provided the documents, they'll say, well, we don't know where they are.
That statement alone explains why many people are frustrated right now. Social Security is rolling out a nationwide processing system, and while the idea may improve things long term, the transition is creating real challenges. Millions of Americans rely on Social Security for retirement checks, disability benefits, Medicare enrollment, or simply getting a Social Security card so they can work. When a system that large changes and even small disruptions can ripple across the entire process, one of the biggest problems is staffing.
Customer service ain't there, and it hasn't been there even before. It was at a 50-year low before they even started, with their chainsaw. But now it's even 10 times worse.
That's a serious warning. Customer service was already at a 50-year low, and after about 7,000 employees left the agency, fewer workers are available to answer questions, process claims, or schedule appointments. Now, combine that staffing shortage with a brand new national system, and it's easy to see why delays are happening. Another important change involves paperwork. Instead of documents staying inside one local office, they are now scanned and uploaded into a national system. Once that happens, your file could be reviewed anywhere in the country. One way to picture it is the famous warehouse scene in Indiana Jones, where the Ark of the Covenant disappears into an enormous storage facility. The object isn't lost, it's simply somewhere inside a very large system. Because of that, there is one simple piece of advice many experts repeat. Never leave your original documents behind. Always keep the originals and only submit stamped copies.
They're going to this national system, which is a good thing, but it's going to take some ironing out.
Another issue people are noticing involves appointments. In some areas, individuals trying to apply for retirement benefits, disability benefits, or Medicare are being told the next available appointment could be 2 months away. Some people try to speed things up by booking multiple appointment types, but that approach can actually cause more delays. Social Security employees work in specialized departments. Some handle general questions, others focus on Title II programs, including retirement benefits, survivor benefits, Medicare, Social Security disability, insurance, and spouse benefits. Another department manages Title 16, which covers SSI, Supplemental Security Income, a program designed for individuals with limited income and resources. If someone schedules with the wrong department, the employee might not be able to process the case at all. Interestingly, many offices once used self-service kiosks, where visitors entered their information and received numbered tickets, similar to the system used at Baskin-Robbins. Some locations eventually removed those kiosks and switched to staff greeting visitors and directing them to the right service. Some people have also asked whether a government shutdown would stop Social Security services. In most cases, it does not. Even when delays affect other federal operations, like reports of long waits at Houston Airport, Social Security continues operating because its employees are considered essential workers. However, certain non-essential services might pause temporarily. That could include things like work history reports used for background checks or some loan-related documentation. A real situation shows how Social Security rules affect families. A mother named Natalie from Colorado has 2 children receiving Social Security benefits. Children can qualify for benefits if they're under age 18 or if they became disabled before age 22. Originally, each child was receiving about $1,300 per month. Later, it became clear that Natalie also qualified for child and care benefits because she was caring for children receiving benefits, and her earnings were below the annual limit. For this year, that earnings limit is $24,480. When the case was recalculated, each child's payment dropped by about $300, leaving them with around $1,000 each, while Natalie began receiving roughly $1,000 per month herself. This happens because of something called the family maximum rule. For example, if a worker's benefit were $2,000, each child might qualify for 50% or $1,000. But imagine someone had 100 children. That would equal $100,000 every month, which obviously isn't possible. So Social Security sets a cap. In Natalie's case, the total family benefit appears to be about $3,000 per month, as long as the PIA, primary insurance amount, and the family maximum calculation are correct. The numbers she was given are likely accurate.